I'm Kristen Sager, and I'm a hematology oncologist out in Mamu. A lot of the patients don't want to come down to Lafayette. I don't blame them. The traffic's awful. And the treatments are hard as it is sometimes, and saving that extra hour every few weeks for the commute is a lot easier on them. But it's still good care. It's still national standard of care. We can take care of almost anything out there. So that's, I think, the most important thing, because it's nice to be able to have that support system without having to go to Baton Rouge or Shreveport or even Lafayette. The patients are just awesome. I love the patients. They're very special patients. They want to do everything they can to help themselves, and it's just a really special patient population. When you come out to us and see me and the nurses in the clinic, we're going to do everything that we can to reassure you and make sure that you feel comfortable with the treatment plan, and really help to make you feel at ease so that it's not so scary. I think you really get to know everybody, all the nurses and the staff, and so it does kind of feel like a bit of a family sometimes out there for the treatment team, and I think that's nice for the patients too. We do this a lot, but the patients don't do this a lot. A lot of times it's their first time. Sometimes they've known family members that have done it. That can sometimes be more difficult because they've had some experiences like that. We just do our best to reassure them. I think try to tell them ahead of time what's coming, kind of lay out the big picture as much as possible so there's not surprises. Just kind of talk through what's going to happen. I think helps them feel a little bit more comfortable, because it's the biggest fear, I think, is the unknown of what's going to happen and what has to happen where and when. And then we try to do things as quickly as possible out there too, because that's another, I think, big anxiety component is the delays.